Hello, everyone. I'm Erica Narducci. I'm the program director at Cancer Support Community Delaware. We are a nonprofit here in Delaware with offices in all three counties, and we provide no cost support to cancer patients and their loved ones through in person and virtual programs of support groups, healthy lifestyle classes, and educational sessions. And today is one of our educational sessions. May is Skin Cancer Awareness Month. So, to help us bring some education around skin cancer, we're going to talk a little bit about the symptoms to look out for, what we can do regarding screenings, how you can prevent this cancer. And to do that, I've asked Dr. Courtney Guerrieri to join me to answer some of these questions for us. She is a board certified dermatologist at Premier Dermatology. And I want to just thank you for being here today.
No problem.
So
Thank you for having me.
great. So we'll jump right in. My first question is, what are the most common early warning signs of skin cancer that people might tend to overlook?
So, one thing about skin cancer, I feel like everybody's looking for melanomas, which are important to look for. But the actual two most common types of skin cancer are actually basal cell cancers and squamous cell cancers. And their findings are quite different than melanoma. So, early signs of a basal cell cancer, these are usually either skin colored or slightly pink little bumps. They kind of look like acne bumps at first. And then over time, what happens is they start to get itchy, and they may bleed and they just don't heal up. They get a scab on top of it. So those are important ones because those are the most common type of skin cancer, the most common type of cancer in general. Um, Squamous cell cancers are a little different. They're kind of the intermediate type of skin cancer, right? Basal cells just kind of stay in place. We just remove them surgically. Squamous cells usually are just in place and we remove them surgically, but they have the potential to spread. So, a sign of a squamous cell is usually a red and kind of scaly patch. Oftentimes, people can kind of feel them. They flick off the scaling and it just reaccumulates. If left alone, those little dry spots will get thicker. They can form even like a little horn on top of it. We call it a cutaneous horn. They start to become painful and bleed. So, obviously, we try to catch these things sooner than later because they're easier to treat at that point. Um, Melanoma, most people know what they're looking for, but I always tell patients to look for changing moles, moles that don't fit the rest of their moles, like something that looks like what we call the ugly duckling, so doesn't match everything else. And that can either be a new mole that looks like nothing else, or a mole that's been there even for many years, but has changed over time. So those are the most common. There are also some other more uncommon ones, like Merkel cell cancer is a very uncommon type of skin cancer. And those are usually larger pink bumps that just aren't healing. So anything that's bumpy and not resolving within, a couple weeks, I usually recommend having them seen.
Great. So, how effective is regular skin screening, and who should be getting checked for most often?
Yeah. So regular skin screening is very effective, especially for detecting basal cell and squamous cell and early melanomas. We do always want patients checking their own skin at home, mostly for the melanomas that pop up out of nowhere, the big melanomas, the nodular melanomas, and that's what we always tell you to look for the ugly duckling sign. But most patients come in for a skin check once a year. And that's why, again, self monitoring at home is important also, because obviously a year is a long time if something is going to pop up. Most patients over the age of 40 just come in once a year, but patients who have a history of melanoma come in more frequently. Oftentimes, for the first year after the melanoma diagnosis, patients come in every 3 months. And then after that year, they come in every 6 months for about 5 years. For non melanoma skin cancers like basal cell and squamous cell, usually patients come in every 6 months for skin checks for about 2 years. And I also have a few high risk patients who've had multiple skin cancers or a strong family history, and those patients also come in every 6 months.
So, what are the biggest misconceptions people have about sun exposure and protection?
Yeah, so I actually think the biggest misconception that I see in regards to sun protection is actually not using it frequently enough. mean, most people are really good about applying sunscreen when they're going to the beach or when they're going to a pool, but they don't necessarily apply or think about applying on a daily basis, when they're going for walks, when they're doing gardening. Those are times where you're still getting a lot of sun, so should be putting on regular sunscreen. And we're also getting UV every day, even if we're not outside, right? We're getting it through the windows, even in short passages outside. So I usually recommend a daily sunscreen, a moisturizer with sunscreen for the face of at least SPF 30. And then if you're really going to be outside, and that includes gardening, a little bit of a longer walk, baseball games, soccer games, putting on true sunscreen, that's SPF 30, and reapplying every 2 hours. Um, Another thing that a misconception that I see is the application frequency for patients. A lot of times people will put sunscreen on once and then they feel like they're protected for the whole day. But sunscreen does break down. And actually, in order to get the SPF that's on the bottle of sunscreen, you have to use 2 ounces of sunscreen every 2 hours. That's a lot of sunscreen. So most people aren't putting this much sunscreen on. So you're likely not even getting the true SPF on the bottle. So that's why I always say the higher the SPF, the better, and just make sure you're reapplying. Um, I do think nowadays most people kind of realize that cloudy days doesn't mean there's no UV, right? Some cloudy days have the highest UV index. So anytime you're really outside, April through October is when the UV is at peak. You should be wearing sunscreen. I think another misconception is that darker skin patients don't necessarily need to wear sunscreen, but no, that's not true. You should wear sunscreen regardless of skin pigmentation. And having a base tan does not protect you from UV damage. So some people will try to get a tan and then feel like they're protected from skin cancers by that. But no, everyone should be wearing sunscreen. I said regularly. In a perfect world, we'd all wear it every day on our face and neck, and then true sunscreen when we're out.
Okay, good. So just having a tan doesn't mean you're okay. You got to keep putting it on.
No.
Right.
And actually, we see a lot of basal cell and squamous cells in patients who their skin type is maybe type 3, so tan more easily than burn. And sometimes these patients have more sun than somebody of my skin type, which is more like a skin type 2. So a higher risk, honestly, of some basal and squamous cells because they just had chronic sun exposure.
Great, thanks. So, how has the incidence of skin cancer changed in recent years, and what are factors maybe driving these trends?
So Delaware actually has had a slight reduction in the number of at least malignant melanomas in recent years. This is likely due to increased awareness of sun protection and sunscreen, and skin checks. There's definitely been an increase in the number of particularly younger patients who come in for skin checks yearly than many years ago. But Delaware still does have a higher rate of melanoma than other states. It's the sixth most common cause of cancer in Delaware as of 2024. Data is not monitored as well for basal and squamous cells, given how common they are. But in general, in my experience, I am still seeing a lot of basal cells and squamous cells um, in the elderly population, but I'm seeing less in patients in their 40s and 50s, which is a good thing. I think it's probably because of more sunscreen use.
Great. And that's what skin cancer awareness is all about this month in May, letting people know they got to wear their sunscreen. So it sounds like it's working. So good. What
It
simple
seems to
daily
be.
Yeah, yeah, good. What simple daily habits can significantly reduce someone's risk of developing skin cancer?
So, and I kind of reiterated this, of course, but I'm a dermatologist. But daily sunscreen use, I feel like that's again something that's now I'm seeing more frequently than I used 2 years ago. And I see it a lot in women, but men also can do a daily moisturizer with sunscreen, always at least 30, because we're getting that incidental sun regularly. And then a true sunscreen every third, at least of at least 30 with reapplication every 2 hours. Another important thing is think about wearing a hat. I usually tell patients when they choose a hat, hold it up to the light, make sure you can't just see right through that hat, because if you can, then obviously the sun can see through the hat. And even when you're wearing a hat, even if you're wearing a wide brim, which is usually what we recommend to try to keep the ears a little bit covered, I still do recommend sunscreen, particularly on the ears, because depending on the angling of the sun, you're still getting some sun even with those. And also think about the chest on a daily basis and neck, because those are areas that we're getting it commonly. Um, we were going to talk a little bit about some recommendations for sunscreen, but usually I'm not super particular on brands, but I have a couple I'll give you the names of. But I usually recommend a cream sunscreen. So investing in a cream, not necessarily a spray sunscreen. And a mineral based sunscreen, which has zinc and titanium, is going to have a little bit better coverage. The other thing that patients can do at home too is, again, incorporate a monthly self skin exam, because as we mentioned, it's once a year that patients have skin checks generally. So we want you checking at home for the big brown spot that changes or pops up, or the spot that's bleeding. A little bit of self monitoring is helpful for those things.
Great. So what about clothing that has SPF in it? Do you recommend that? Is that helpful?
Yeah, so absolutely, I should have mentioned that also. So wearing regular clothes like a white t-shirt really only has like an SPF of like 6. So that's not helpful, but the UV woven clothing can be very
Mhm.
helpful. So they can replace sunscreen. And they do have some nice ones that have sleeves, that even have hoods that can protect the back of the neck, especially for people who fish. I feel like that's a big one, of people who are constantly in the sun. And there's a lot of great brands that provide or sell some of those. And there's actually some nice brands who sell some more dressy clothes, dresses, those sort of things, for women who have longer sleeves, so that they don't have to worry about sunscreen if they're going to be outside.
Thank you. So you did mention, I was going to ask sunscreen favorite brands. I love Supergoop. That's my go-to. What else do you kind of like?
So yeah, Supergoop is nice. The one thing about Supergoop that's nice is some of their formulations, like the unseen sunscreen, are light on the face. They tend not to run. So particularly if people who spend a lot of time outside, either working outside or gardening or whatever have you, theirs tend not to run as much. Especially, like I said, the unseen sunscreen. In general, a zinc and titanium based mineral block sunscreen is good. So Blue Lizard is one of those. I've recommended Blue Lizard for many years. It's a thick sunscreen. So, but it's, I feel, particularly good for, somebody who is away in a sun environment that's different than their home sun environment. So you're at the beach or you're on a tropical vacation, and the sun is just much stronger than you're used to. Something like Blue Lizard forms a nice barrier to protect you. And they're also reef sensitive or reef safe. So that's another thing now. Some of these other countries where you're going and doing snorkeling or scuba diving, they often want to make sure that the sunscreens are reef safe. So Blue Lizard is a reef safe sunscreen.
Excellent. Great. Thank you so much. I want to thank you again, Dr. Guerrieri. That was excellent information and a great overview of everything. And so thank you. And hopefully we'll be seeing even less cancers.
Hopefully, I do. Like I said, I've seen less. So, but yep. Don't forget to make your skin check appointments. We're happy to see everyone.